The patient should be in supine with the legs fully extended, and the therapist will brush the sole of the patient's foot. If the client stimulated leg posture into flexion, then impairment is shown. This reflex can impede the patient's ability to accept weight on the lower extremities during transitional movements. The patient should be in supine with one leg extended and one leg fully flexed. Impairment is shown if the stimulus caused the flexed leg to extend and adduction internal rotation of the hip. Impairment can allow patients to have difficulty with bed bridging and with balance. The patient will be in a supine position with both arms and legs extended. The therapist will passively turn the patient's head 90 degrees to one side. Impairment is shown if the patient assumes flexion of the extremities toward the skull side and extension of the extremities toward the face side. This may prevent disassociation of the head and neck visual scanning, rolling in bed, or holding objects with both hands and bringing the objects to the mouth. The patient is placed in a seating position and the neck is passively flexed toward the chest. Impairment is indicated there is flexion of the upper extremities and extension of the lower extremities when the neck is flexed. However, when the neck is extended, the patient's lower extremities would extend and the upper extremities would flex. Patients with this reflex may have difficulty transitioning from supine to sitting positions. The patient would be in supine, and the therapist would observe the postural response. After a patient would be put in prone, and the therapist would observe the postural response. Impairment is shown if the patient exhibits extensor tone while in supine and flexor tone while in prone. This reflex prevents the patient from transitioning between movements when initiated with head movements or sitting up.